More and more people are taking supplements today, but are they safe to take with medications? We went to the Comprehensive Cancer Center at Desert Regional Medical Center in Palm Springs and spoke with Dr. Timothy Tyler, the Director of Pharmacy Services. We asked him to talk about supplements and medications and patients who use multiple pharmacies to fill their prescriptions.
The concept that of patients having multiple pharmacies, multiple doctors, we call that polypharmacy. I'm getting one prescription here, I get my other prescriptions here, I go to see a naturopath and get some supplements, and then I go to Costco and shop and you know, this looks good, and oh, that has something that I need. And pretty soon, when a patient comes to see me, they may come in with a bushel full of things they're taking, and it gives you pause. The other problem is that many times patients don't take them all at the same time. They're sort of self-medicating. Well, I only take this occasionally when I have this problem. That's okay, but that's also not okay. So when physicians particularly are managing patients, they have a medication list that they think the patient's taking. This actually is illustrated by the Cancer Center. Many years ago, we had patients that were coming to us, and we assumed, and I use the word assumed, that if they were taking anything else, they would have told us. Here are the medications I'm taking. We found out, we did a 6-month study. We actually published this. I presented it at an international conference. We published it and we found out that patients weren't volunteering any of the supplements, vitamins, or other things. They were only doing what we asked them. What medications are you taking? When we started a 6-month pilot, we found out that nearly 80% of our patients, 4 out of 5 patients, were taking something that they hadn't told us about. On top of that, 40% of those were actually taking something that was not probably what we would have recommended. In fact, it was kind of against what we wanted. We want to be sure that if patients are taking something, they're very clear with their healthcare providers that they're taking it. The other thing that's important is when they're combining some of these things, you can become very, very sick. For example, I have patients that take lots of vitamins. They'll take a large amount of vitamin E, they'll take a large amount of vitamin C, large amount of vitamin B something. The good news is a lot of the vitamins are water soluble. The body at some point goes, I reached my saturation point, and we basically urinate them out. But the fat soluble vitamins, the body doesn't have an easy way of just getting rid of those. So if you take too much, you can get something called hypervitaminosis. Now, that would be hard. You'd have to really work at it. I've seen some cases where that's happened. You can, sort of a layman's way of guessing is when you have nail changes and your hair starts falling out. But generally, when patients are taking within the recommended allotments, they'll be fine.
What is your best advice for patients taking supplements and medications?
My advice would be to stick to something that you have a very high likelihood of having a problem with or already have an existing problem with. Instead of taking a vitamin or a supplement from every aisle in Costco, it would be appropriate to really focus in on what are the concerns and work with your clinicians. So again, talk to the over-the-counter pharmacist in a retail setting. I'm in a hospital, and many, many times patients are surprised that what they're doing isn't necessarily what we would recommend.